My name is Dr. Barbara Rodwin, and we're going to talk about myths of chiropractic. One of them is, with respect to chiropractic, I am a doctor. We actually are known as doctors of chiropractic. And what that actually means is I am a diagnostic health care provider. So I'm one of the primary healthcare providers in Canada. We have 6 different diagnostic healthcare providers, so your medical doctor is one as well. And what happens is if you go in to either see your medical doctor or myself, you can come in, we actually assess what's going on. We can diagnose what your issue is or what we think it could be if it isn't that problem, and send you on for referrals to different types of diagnostic health care tests, such as MRI, CT scans, x-rays, blood work. So I'm able to help with some of those or refer you to have them done. Another myth with respect to chiropractic is that we are neck and back doctors only. We do treat other areas of the body. A day doesn't go by where I'm not actually working on a toe joint as a result of a bunion and loss of movement, an ankle, a knee, a hip, shoulders, elbows, fingers, thumbs, jaws, and even the skull. I have training or extra certification in helping with skull adjustments. Get your head examined. So we do treat different types of joint problems, even ribs actually. If I think about today with practicing and treating patients, I've worked on a couple different rib-related injuries too. So think of us for other types of problems. Even sinuses, I work on sinuses. A patient today said his feel amazing as a result of things that I've done before for him. Another myth, in a sense, is the educational process that we go through. I've had patients years ago think that maybe we went to school for a year or two. It is a 4 to 5 year program at the chiropractic school. It's a 5-year program, and the one I went to, they condensed it into 4, so it's a lot of extra more work over the summertime as well. And then we have to actually do an undergraduate and have certain types of classes prior to getting into the chiropractic school. We as well are interns, just as medical doctors are, and we have to actually train treating patients and present those patients to our clinicians and then treat them. We have a strong educational basis in neurology, so that's the study of the nerves. We also have it in the muscles and the skeletal system and how everything with our body works together. We do as well have a lot of X-ray, MRI, and CT scan readings, so I do read my own and I can report on them as well, so I can prepare reports with them. So we have quite a bit with that. And then another type of thing that we are trained in quite a bit is with nutrition. We have an excellent nutritional background with understanding how everything works in your body and how if there is a deficiency of magnesium, it could give you constipation, headaches, migraines, and if you do have chronic pain, it could deplete your magnesium. That's just one example of something with your nutrition. So a day doesn't go by where I'm not helping somebody with something, saying, oh, maybe you need to increase some melatonin for sleep, for instance. So those are a number of other things that we actually specialize in. Another myth is what the sound is when I actually adjust patients. So an adjustment means to restore movement to the joints or bones of your body. So joints could be toes, as I mentioned before, ankles, knees, hips, lower back, middle back, neck, shoulders, elbows, wrists. There are noises, little popping noises like popcorn associated with that. And patients often will say, hey, doc, can you crack my back? And they often think that it's actually their bones cracking, which it's actually not true. In between the 2 vertebrae in particular, and it can be other areas, there's a little fluid-filled sac that actually lubricates where 2 joints move together. And when I do adjust that area, as a result of the way the adjustment occurs, there's an equalization of pressure across that capsule. And that noise is the equalization of pressure or gas being released into the joint. So it's much the same as when people crack their knuckles. They're actually doing the same thing. The It's actually referred to, if you want to Google it, cavitation. Another myth with respect to chiropractic is that if you get your neck adjusted, that you could get a stroke. There are risks with everything that we do in life, and there have been instances where things have occurred, but the risk is actually 1 in 4 to 5 million that something like that can happen. And that's why when you come in to actually be examined, we take a very detailed health history about the medications that you're on, your family health history, the symptoms that you have, and then the exam itself helps us to understand what style of treatment that can be done if we need to work on your neck. Now, if people aren't comfortable with, because they're worried about that risk, there are other ways of actually adjusting the neck that is not a higher risk factor for neck and stroke related issues. So you can be treated in other ways too. So think of that with chiropractic and try one of the alternative routes of adjustments. The next myth is that I'm seeing a physiotherapist and that's the same thing. Doctors of chiropractic and physiotherapists actually treat differently. Physiotherapist often deals with more of the muscles and will only work on one area of your body at a time, normally. We as chiropractors will look at the body as a whole. So let's say you're having a knee issue, it could be the movement of your foot that's affecting it, or your hip or your lower back. So I actually examine the foot, knee, hip, and lower back for that to determine how the whole mechanics are working. And then when I do examine it, I treat the muscles, the joints, and the nerves together. Physiotherapists usually use the one body part and they treat more muscles than other areas, commonly. So one of the other myths is once you go to see a chiropractor, you always have to go for the rest of your life. That's not necessarily the case. There are different types of care. One is called relief care, that when you have a problem, you come in and you get it fixed. So it's the same as taking your car in. When it has a problem and the engine light goes on, you take it in. Then there's another type of care called corrective care. If there's an imbalance with something, you come in to then have it corrected to be able to go past that relief type of care. And that would be the same as having checkups done on your car. Then there's another type of care called maintenance care. And that would be later on in treatment, once we've corrected a lot of it, that you maintain things. Because we do a lot of things in our daily lives. We sleep sometimes. We want to sleep properly, but sometimes we sleep incorrectly. Sometimes we sit incorrectly. Sometimes we lift. We're always undergoing force and stress on our body with sports that we do, walking, sitting incorrectly, traveling, sleeping on other pillows and beds that affect our whole body system. So then some people come in and have treatment to be able to maintain their bodies as they age. So it's actually your choice when you go to see a chiropractor which type of care you'd like to choose. Because if you think about it too, when you were you born and you never really went and saw a medical doctor again? You go in sometimes for physicals, which is actually maintenance care, and sometimes you go in because you have a problem. And some other people go in when they have problems to keep things corrected by having medications refilled and things. And that's a type of corrective care too.